The Lagos state government says providing healthcare for residents remains one of its main priorities. The government said this during the first phase of its free medical outreach, Alafia Eko, at the Campos Memorial Mini Stadium, Igbosere, one of the state's 6 health districts. According to the special advisor to the governor on health, Dr. Kemi Ogunyemi, beneficiaries have the opportunity to receive free checkups and treatment for blood sugar and blood pressure checks, eye examinations, and free glasses, among others.
With regards to Alafia Eko, where the Ministry of Health was actually involved, what we did was we decided that we will have 4 units per district, making 24 units, and we will see 1,000 citizens per unit, which equals to 4,000 per district. Times 6 is 24,000, and I'm sure we're going to see more than that. So what he plans to achieve is that let's help people. Those who are ill, those who cannot afford certain drugs, we will give them free for 1 whole month. And then also we'll register them. We have LASRA, that's the Lagos State Registration Agency. And then we also have LASHMA, which is our Ilera Eko, which is a health insurance. And the whole idea of that is that when people buy health insurance, for 1 year, they will not have to pay for certain drugs. Now, it's not all drugs, but your basic drugs, your basic care will be free. And that is huge for citizens because they can't get that anywhere else. That helps them feel better because, a healthy economy needs healthy people. So health and economy come together, and that's what Mr. Governor, through his compassion and his care, came up with this, and he's paid for every single person. But you must be registered with LASRA because this is for Lagos citizens. As you know, people are coming from all over to come, and that puts some pressure on us. So we want people to register before they get it, and then they'll be seen. And we also have eye. A lot of students, a lot of older people, they have diabetes, they have issues with their eyes, they need glasses, and they're getting the glasses free here as well. All pregnant women still get antenatal care free. Delivery is free. Whether it's cesarean section or normal delivery, is still free. And that has been on for some months.
For this program, definitely we will be providing everything that the SA has said. And then we're linking them to the nearest PHC as well. They will pick up drugs in another 2 weeks, a refill of the drugs we've given them. And then that also gives them an opportunity to then get linked into the system in that PHC. As the SA has said, there's an opportunity to register for LASHMA, Ilera Eko, and then they will be given 100 people in each of the centers that we're using. We're using 24 centers, 24 points for this outreach. 100 people will be getting free access to health insurance for 1 year. And those people are the people that we consider vulnerable. So there's a way they determine here, there's a questionnaire they will use to find out if you're a vulnerable person, someone who can afford treatment, who can afford access by themselves, and they will get access to free treatment for a year. So 100 from 24 places is 2,400 people, apart from the 24,000 people that are getting access to these free drugs and this free treatment. So it's all about making sure no one is left behind and there's universal access to healthcare for all the residents of Lagos. And that's why it's important that you get registered with LASRA first.
We want to give kudos to our governor, our performing governor, for deeming faith and believe in acts, that act is words. And at the same time, the assurance we are giving you, it's not about assurance. It's simple. You can see the number of turnouts. The program now that we are expecting 500 today for the first day. By now, the accreditation has reached over 400.
A medical doctor, Bolanle Johnson, urged residents to always pay attention to their health.
Many of our residents to come in routinely, even for things as simple as anemia. I mean, a lot of people are not eating well now because of course, the economic issues that are on. So just a little, and being able to tell them, take your warm expellers, take your blood tonic. It can actually help them. A lot of people are coming down with low blood values, which would affect their productivity. So they come in and they are avoiding the hospital because of time, because of money. But many of these hospitals, particularly primary health centers, are very accessible. They are within the community, they are within walking distance. They are able to find the routine and the most simple ailments that can go on to cause very severe illnesses and cure them before they become severe.
Some of the beneficiaries say initiatives like these will give residents access to free health care.
Very, very good. Trying for everybody. We always pray for him to be alive. Yeah. So we thank God for everything he did.
First of all, I thank the Lagos State for organizing this, for giving us opportunity to have all what we gain here. I benefit from having my BP, the weight, and the malaria test and the drugs. Everything is free of charge, and we thank Lagos State.
There's a lot of benefit in this type of program. You understand? If the government can continue to know this, our people, to help our people to know their status, to help them to live longer. You understand? Because the healthcare community is the richest community. You understand? Coupled with what is happening in Nigeria now, if government can continue with this type of program, allow people to come to check their status to know what their body is like, I think it's a good development. And we thank Lagos State government for doing this. We pray and we hope they will continue.
I want to thank the Lagos State government for giving us this opportunity to partake in this kind of great thing. I really appreciate the Lagos State government. May God continue to bless them and continue to give them this opportunity to give us, like we that don't have the privilege to go to the hospital, to the clinic.
Access 24 reports that the initiative is a part of the promise by Governor Babajide Sanwo-Olu under the Eko Cares program, which was meant to reduce the hardship of the present economic situation.